Now, how can you rub a reflexology point on my foot and clear a headache? That's ridiculous. But we see the body as being a long way from the brain, but it's not. It's all just one organism. So when something strangles us here, it's strangling us here as well. So now we've got an ASI that can move inwards and outwards, so in flare, out flare. It can move with the craniosacral movements, and it can move with the opposite rib cage to give us this rotation of the pelvis and the hips, so we're getting this proper walking action. The biggest thing that causes problems in the body is if the lymph can't clear pathogens out. The result is cancer. When we're looking at that, we're looking at all these different forces that act in the body. Now, because collagen is very conductive, it has to be hydrated to be conductive. So when a muscle is being overworked or pulled or in distortion, or an organ the same, it becomes less conductive. Now, when it becomes less conductive, the meridian energy that runs through it, which we call chi or ki, has electrical properties, it has magnetic properties, and it slows down. Our nervous system doesn't work properly. We get dissonant signals. So we need to hydrate tissue. So the scalenes are a very important muscle to give back the integrity of the weight of the head back into the coronal plane. If you can't get oxygen to an organ, if you can't get oxygen to a tissue, it's going to slowly die. And even breathing techniques from Wim Hof and ancient Buddhist techniques talked about breathing to organs and breathing through these channels, because if you can get oxygen to an area and reliven it, that's the answer to a lot of cancers, and they're starting to think that way now. They're starting to use oxygen for those kind of diseases. When you cross the interface of the tissue, you are affecting the peripheral nervous system and the channel system. But basically, you're hydrating the tissue again, mechanically. Now, what happens when we get an injury is we get shimmies in various areas. So if your thoracic inlet was imbalanced because your sacrum's out, then your pleural dome cannot be equal. And the things that pass through there are vital. I mean, the blood to the head for one, but also the drainage from the head for another, but also the lymphatics from the whole of the body coming up to the left thoracic duct for another. So it's a very important area not to have shimmy. So when you understand what a shimmy is, then you can find a shimmy on a person and reverse it. And that's where the Budo becomes the medicine. So that was my introduction to pressure changes tissue. What on earth is this pressure? But it's how you press, and that's how we press is very uniquely, and where you press, which is very, very important. And I can lean and stretch that area slightly as I take the knee inwards and come down the points like that. The difference between pressing and loading. So if you're pressing, your backstop is your shoulder, and you lose a lot of the sensitivity, and you don't move the dynamics of the tissue beyond your fingers. If you're loading, then the opposite happens. You're then affecting the whole tensegrity of the tissue. Coming down here like this, he could be doing this. He's cupping, but he's listening. So then he'll come down, he'll stop, and he'll go, this one, okay. Then he'll work the point. Because what you find is, if you're using a percussive technique, it changes. It's almost like tapping on a xylophone. You get a nice tune, nice tune, nice tune, and then you get a deep thud. Then that's the one that's subluxated. He would work the points and work it with his hands like this, and not manipulate. And you go, right, okay, that's his approach. Because when we put pressure to the body, it changes the dynamics, and it changes the water constitution of the tissue to make it more conductive. And that's a really important finding.